Good afternoon, and welcome to the training on CDSS alerts, practice alerts, and registry alerts. Do any of these sound familiar to you? Is anyone currently using these? Today we're going to show you the difference between these three, how to use them, and how to suppress and turn off an alert. So first let's talk about the benefits of using the CDSS alert tab. We can help clinics maintain a high quality of care. In this way we can be proactive about the patient's health. We're not just treating the symptom, but treating the whole patient. CDSS alerts can also standardize the care across all clinics, so the patient will receive the same care regardless of which clinic they visit. We can also help staff work at the top of their license. In this way, the CDSS alert tabs are the tools to help you know what work needs to be done. So where are the CDSS alert tabs located? They're located in 3 places in ECW. First, in the hub. You can also find the CDSS alert tab in the dashboard. From these 2 locations, the CDSS alert tab from the hub and dashboard give a complete summary of what alerts are due, what alerts have been satisfied, and what alerts have been suppressed or turned off. The last location you can find the CDSS alert tab is in the right-hand chart panel. This will show what alerts are due now, and it's the easiest one to use. Let's talk a little bit more about the right-hand chart panel. It consists of 3 sections: the CDSS alerts, the practice-created alerts, and the registry alerts. The CDSS alerts are preset by ECW and are triggered by a variety of reasons, such as age, sex, diagnosis, or a mixture of all of these. Practice-created alerts were created by HealthPoint. They are triggered by a single item, such as age, diagnosis, sex, or medication. These alerts are satisfied when the linked lab or DI has been received, the linked procedure is marked as received, and/or the linked vaccine has been administered, or the linked historical vaccine has been recorded. And the registry alerts. These were also created by HealthPoint, and these can be highly complex because they can be triggered by a combination of sex, age, and/or medical condition. These will remain present until the condition has resolved or changed. So just a few points to remember. The right-hand chart panel is the quick and easiest way to see what alerts are due now. The blue box indicates an alert is due. The red box indicates the alert is due within the next 90 days. Just a disclaimer, alerts provide basic guidance. Always verify what is due. So what does this plus sign mean? The plus sign is only visible from the progress note. Clicking on the plus sign beside the alert will show you what is linked in order to satisfy the alert. For example, smart forms, quick order sets, and order sets. Let's take a look at a smart form. The depression alert is linked to a smart form, and clicking on the gray arrow will cause a smart form to open. Here's an example of a quick order set. The quick order gives you the option to pull into the progress note a lab, DI, injection, and/or procedure that will satisfy the alert. You will receive this pop-up, so be sure to click on the appropriate assessment. Remember, the problem list is pulled from the patient's chart. The linked assessment are items you usually want to link your procedure, lab, DI, and/or vaccination to. At times, it may be appropriate to use an assessment from the problem list, but typically items in the linked assessment will be your quickest option. Let's take a look at an order set. Clicking on the blue plus sign allows you to click on the order set associated with the alert. Again, you will receive a pop-up for the linked assessments. Be sure to click the appropriate one. At times, an alert may be present but not needed. For example, there are 2 types of pneumonia vaccines, Prevnar and Pneumovax. The pneumococcal alert is linked only to the Pneumovax vaccine. It is usually recommended that a patient receive the Prevnar first, then the Pneumovax at least 12 months later. So let's look at suppressing an alert. Suppressing an alert means you can suppress an alert so it does not show up in the right-hand chart panel for a specific length of time. For example, in the CDSS alert section, the pneumococcal vaccine is present. This alert is linked to the Pneumovax vaccine only. Since the patient received the Prevnar 13 today, they do not need the Pneumovax for at least 1 year. We can suppress the pneumococcal vaccine alert for 1 year, and when it shows up again, the patient will be due for the Pneumovax. Now let's take a look at how to turn off an alert. For example, in the practice created alert, the need mammogram is showing. If the patient has a history of breast cancer and received a bilateral mastectomy, she no longer needs mammograms. Putting a check mark in the Never Remind button turns this alert off, and it will not show up in the right-hand chart panel anymore. Some limitations to suppressing an alert. Only alerts in the CDSS alert section can be suppressed. Practice-created alerts can only be turned off or never remind, even though it gives the impression that you can suppress them. Registry alerts can neither be suppressed nor turned off. A summary of limitations. You can undo any suppression or turned off never remind. Any alert can be turned back on because alerts cannot be deleted. And suppressed or turned off alerts will not show up in the right-hand chart panel, but they are always visible in the CDSS Alert tab that is in the hub and the dashboard of the progress note. Please give us a call if you have any questions. We'd be happy to help.